You're listening to Paris Undressed on Paris Underground Radio.
Welcome to Paris Undressed. I'm Kate Kim Griffin, your host and the author of Paris Undressed, The Secrets of French Lingerie. Every week, we go behind the scenes of the lingerie capital of the world to explore femininity and sensuality. And if you listen carefully, tuning into both the conversation and the whispers of your body, you'll find joy, beauty, and delight. My guest today is Alexia Cassar, a nipple tattoo artist dedicated to helping women rebuild and reconnect to their bodies after breast cancer. With more than 20 years of experience in oncology, Alexia offers a different kind of attention and care for women who've had surgery and creates 3D nipple tattoos with artistic beauty and scientific precision. In today's podcast, we explore the art of tattooing, the awkwardness surrounding nipples, and why they are such an integral part of our intimate selves. Hello, Alexia. Thank you for joining us today on the Paris Undressed podcast.
Hi, Kate. I'm really glad to join you.
Would you tell us just a little bit about yourself, where you grew up, and perhaps what did you dream about as a young girl?
Well, I grew up in the Paris region, in a very close village close to Roissy Charles de Gaulle Airport. And I was dreaming about working with animals. I've been for a long time an animal lover and a nature lover. So my plan was to be like a vet or something, working with animals, because I was drawing them all the time. I was passionate about life and passionate about animals. And that was my dream life.
So as a young child, you were also creative. You were already making illustrations, or were you painting? Was it with pencil or was it with watercolor or?
I could use any kind of media to illustrate my creativity, but mostly I was like using pencils because I was drawing everywhere. So it was the more convenient for me when I was at school, when I was in a waiting room, when I was traveling. I always had a bunch of paper and pencils.
It's always interesting to see how one's career unfolds and then where that little nugget of creativity started. So as a tattoo artist and drawing, you couldn't have forecasted that as a young girl, yet it's already there. Did you come from a family that was creative? Was it something that was encouraged in your family, or was it something to be done in a pastime and not to be taken too seriously?
No, actually, I think some genes were there at the beginning. My father was a industrial designer. At the end, he worked in Air France as a mechanic specialist. And my mother was a teacher, but she was teaching everything. So she was not only teaching things about art and everything, but actually, I can say that we all as a family were involved in drawing together and doing creative stuff together. And I was in a pretty good environment for that. So that was encouraged.
And as a young woman, what was your relationship to fashion and in particular to your own body?
Oh, it was a non-existent relationship when I was a teenager. It's funny to think back those years as a period of time where I was really not comfortable with being a woman, because in my family there was lots of boys, and there was something around being superior as being a boy. So at a very young age, I think I had the conscience that I should be a boy if I would be like first of the row, and I was doing everything to be first, to be the very first doing things, and my femininity was like one step behind, and I was acting like a tomboy, or I was like always wearing pants and large t-shirts and disguising my own body, and having people forget about my femininity was something I struggled with for a long time. It's funny that now I'm trying to rebuild that femininity over people who have lost them to cancer. So it's a long way to be able to do that.
And did you develop early? Did you have curves and breasts at a young age?
No, actually, I was not. I was quite skinny, but the little signs of femininity were disturbing for me, because I was like bearing them something I didn't want to deal with. So I was hiding them from the rest of the world
And from yourself.
and from myself, of course.
Of course, yes. What 3 words best describe your personality?
I'd say brave. I would say I'm an Aries in the, let's say, an astrology. So I jump, I go head first, and I would say that I'm a little bit too picky on things. I like to have things done right. That's a lot of words, not 3 words.
Yeah, so a little bit of a perfectionist
Yes.
in there, that you want things done right. Head first could be a bit of a risk taker as well. You're just, or maybe tunnel vision,
Yeah.
that you see what you want and what you need and how to get there. And that definitely needs bravery to do all of that. You're a tattoo artist, and you are the founder of the Teton Tattoo Shop. So I'm not translating any of that. The real name of the company is the Teton Tattoo Shop. And teton is French for nipple.
Yes.
And tattoo is a permanent mark or design made on the skin by a process of pricking. So nipple and tattoo are not 2 words we expect to hear in the same sentence. But before we get into all of that, let's just talk about nipples first, because nipples are a tricky subject, both in how society views this part of a woman's body and for women themselves. And in my own conversations with women, many bra choices are made based on whether to show nipples or not. And some women are more comfortable with them than others. So, what is your impression? I'm interested in just sort of talking a little bit about what's your impression about how we view nipples in the public sphere, and in particular social media, and if you see that it's changing in any way.
It's absolutely changing from times to times, and it's crucial to understand that now there's a very disturbing focus on feminine nipples, as they are banned from our daily activities. They are banned on social medias. They are banned on the movies. They should be banned on clothing. We see a lot of things that should be hiding the nipples from the bodies when they are from a feminine perspective, which is strange to me, because we all mammals are born with nipples, and they are just part of the bodies, like your toes or your ears or your nose or everything. So I think it's a matter of, let's say, period of time. When I was a young girl in the 80s in France, we used to have, at the dinner time, we used to have TV shows where playmates were taking off their clothes during our dinner, and it was like normal. It may have been disturbing for us children, but it was like normal. And people were having some bathing activities on the beach. There were like topless women everywhere. No one was disturbed by that, and I don't understand that very recent wave of hiding the bodies, and in a sense that we are pushing self-acceptance, body positivity, everything about telling people you should love your bodies no matter how they are built, no matter how they are working, no matter gender, age, or health status you have. We are opening ourselves to body positivity, and at the same time we are restricting our views towards nipples. So I don't understand that. I don't accept that, because I think it's a way of shaming people, and it's a way of preventing people who have a need of information to take care of that part of their bodies. We know that breast cancer is hitting more and more people, and women and men should have the correct level of information. So if we are preventing nipples from being seen, we are preventing a part of their body to be visible, and we are preventing our health messages to come to them. And that's something we should worry about.
I agree, but I also think there's some uncertainty within ourselves with this part of our body, with something just even like the bra in a changing room with women, when the form of the bra might show the nipple or not. There is this, it's a big question. Do I show my nipples or not? And most of the time it's, well, I can't. And when I ask, well, why can't you? Oh, well, I don't know why I can't. I just can't. So the woman herself feels as it's just something to be covered up. And in the lingerie market, as when I was running my lingerie company, I actually even sold something called a nipple cover. It was a silicone nipple cover to cover your nipples underneath your bra. And there's just this particular part of the body, it's breasts already are a big subject, but then this particular part brings up a lot of different questions as well, and feelings of whether it's a part of your body that you like or you don't like. Often when the breast cancer comes, if you're going to lose your nipple, then you suddenly realize that you're even perhaps more attached to it than you thought. But the nipple itself is a funny, there's a particularity to it as well. And I teach breast self-exams. And so the autopalpation, and when we're doing it, often the women skip over the nipple too. And I say, no, you actually, you go over the nipple as well. Oh, I didn't know I could. I didn't know I could. There's some resistance to even touching ourselves, that part of our body. What is your relationship to a nipple, your own nipples?
Well, I think like majority of people have been taught that they had this maternity relationship I had to have with them. So we are instructed as young women that it's better to give your own milk to your baby, and then you have amongst the society you have this sensation that it's a sexual part of your body and that you should hide it because you should not wake the masculine instincts towards this part of your bodies. And if you have a lingerie that shows up the nipples, or if you have a t-shirt that shows up the nipples, you can be like seen that someone appealing these masculine instincts. So I think that better than having women banning their own nipples to the society, we should first educate society and educate that masculinity can be toxic for women's self-acceptance. So I think that from a very young age, I had this feeling I should hide them. I should hide my body. I should hide my breasts in a general way of seeing them. And when I was when I happened to be a mother, breastfeeding was something very difficult for me because it was painful. I was not instructed to do it the right way, and I was like taught that this is something very instinctive, that all women can do that, all women should do that, all women can do that. So the message was not very positive again. And well, it's not easy to find someone that you can talk about your nipples. It's not very easy. You don't talk about your nipples with your friends, with your best friend, with your mother or your sister. It's something that you keep for yourself. And a lot of women can have, let's say, they can dislike their part of their bodies, and some of them want to change them. So there's a lot of surgery that is asked for inverted nipples, say for big areolas, for big nipples. A lot of women have how to say it? Is it like in French, complex?
Yeah.
Yes, they want to change rather than they are in a way of accepting them. So having them shown in the variety that they have, all nipples are different and they can be loved just as they are. So if you see a lot of them, you can say, oh, mine is normal. Mine is not that different. They don't look the same. Most of the time they are different. For one woman, she would have different nipples. That's not something unnormal. But if you don't see them, you can't have this quiet and peaceful relationship with them that you should have. If you're instructed from your very age that it's normal that they look different, it's normal if one breast is bigger than the other, that hormones can make it different when you are pregnant, when you are breastfeeding, when you have no more activity, hormonal activity. So we have to consider them during the whole lifetime, and having the chance to spend a lot of time with women who have lost their nipples, I can tell you that's something very important. This is not just a detail on their bodies. And if they had the choice, they would have kept them, even if they were not perfect and not the way they would have liked them.
If you're enjoying this episode of Paris Undressed, You may also be interested in Storytime in Paris, hosted by Jennifer Garrity, who interviews contemporary authors with a French connection. Every episode includes a reading, so sit back in your armchair and tune into this page-turner podcast. Paris Undressed will be right back after a word from our sponsors. I think the nipple is something that just sort of gets encompassed with the breast, and it doesn't get its own headline. And then when breast cancer or any illness comes up, when the decision to take a part of you, hair included, you don't want to lose it. You didn't realize that this part of you was more than you thought. And it might not change your decision, but your attention to it and your realization of its importance. But the subtlety of the covering up is pervasive. I mean, an entire industry of t-shirt bras is based on this notion you can't show your nipple underneath a t-shirt because, oh my God, you won't go to heaven or something. There's this morality or this decision made for you. And quite often it's not something that you've even thought there was a choice. And so in a very simple conversation, as I'm sure you have with women as well too, when it's just, well, do you like your nipples or not? And acceptance can be also, well, I don't particularly have any particular relationship with them. I don't want them to show. But if you want them to show and never thought that you could, well, that's a different realization. And then suddenly there's some choice available. So I'm hoping that for all of you listening, just ask yourself, what is your relationship to your nipples? Is it a big deal, not a big deal? And if you're covering them up, are you covering them up for you? Or are you covering them up for another reason? And I think that's an interesting observation to make. So tattoo. This word also comes with its own cultural perceptions, and deeply embedded in some cultures as an old tradition, and in others, tattoos are considered taboo. How do you perceive the art of tattooing has changed over the years?
Well, you know that men and women have been tattooed for many years, and the most ancient ones have like thousands of years. And they were doing this not only for aesthetic reasons, but it's been clear that they had therapeutic indications in tattooing themselves. So in the very beginning, it was like a sacred form of art that has evolved during those years to be a self-expression of liberty, freedom, physical status, or maybe like social place for people who have been tattooed. It's a revendication of who you are and the place you want to have in a society. Even it can exclude you from the society sometimes. But the fact that it's a permanent thing, it defines tattooing like something very antagonistic with fashion. Fashion is moving, fashion is something that goes quick and changes, and tattoo is a permanent thing you placed under your skin. So you have to think twice, and think before you ink is something very important. So I think that it's a good thing that it has become popular and has been removed from its very dark side. But in a sense, it has lost the sacred part of it. And I'm very traditionalistic in terms of my way of conceiving how I learned this form of art and how it should be transmitted from one people to another. We should always respect that we have a responsibility as a tattoo artist because we are marking bodies of people for forever. And if you are taking the risk of putting some ink in someone's skin, you have to understand how this has a consequence, a lifetime consequence on how they will be perceived, how they will be seen by the others, and how they will behave in their own life. And not only for sanitary risk that you can expose them to, but also you can have them banned from society if you tattoo the not right thing. So I think it's a very, very pure form of art, and I'm very glad that I've been instructed by a very responsible person and and even myself. I'm lucky to have been tattooed by masters that have taught me how important is it to respect and love this very sacred form of artistry.
It's beautiful. So let's bring these two words together, nipples and tattoos. You bring the art of tattooing to help women who've had breast cancer. So can you just talk us through a little bit about what you do and how you got started?
Well, first, when I was a child, it was clear to me that science could relate to what I liked the most. Like every form of life was was a passion for me. So I involved myself in studying biology very early in my scholarship, and I've done all my studies around biology because I was like in a very deep need of understanding how life can start and can end, in the sense that learning these mechanistics and how this could impact people's life in a sense was very important for me. I was not self-confident enough to start with medicine studies, so I remained a simple biologist. But I was involved in developing treatments for patients. And when I met with cancer science, it was like a revelation for me. So it's been 25 years now since I've started learning about cancer. And since that day, I have not been able to start looking at other types of diseases or treatments. So first, I was a cancer biologist. And I've become a mother. I had three girls, and one of them, the youngest one, was born in 2012 with something different. She was born with Down syndrome. And that was another jump into what life can send you, because this very simple particularity has exposed her to another risk. And even if we had been clear that Down syndrome could not impact our lives in a negative way, unfortunately, she was hit by leukemia, because this kind of leukemia was related to the fact that she had Down syndrome. So when she was 10 months, she was hit by acute myeloblastic leukemia, which is a very rare and very serious form of cancer for children. And she had to go through chemotherapy, 6 months of hospitalization and everything. And at that time, I was working as a scientist for a pharma company, and I was working in clinical research and medication development. So it changed for me the way I was perceiving cancer in a very personal way. I've been working to fight against its consequences on patients' lives, but at that time I was personally hit, and I had to rethink my whole life around the fact that I was a scientist, and how I could help patients in a different way, because I was like someone helping patients in somehow in my own life. So at that time, I discovered the interview of a US based tattoo artist, which name is Vinnie Myers, who is like the god of tattooing nipples. And that 3-minute video has had a very large impact on my life, because I realized looking at it that this was something I would do. And I was like appealed to do something like that. So it all started with this video. And I spent like 1 year thinking about it, asking surgeons here in France how they were doing nipple reconstruction after cancer, what were the techniques available in France or more largely in Europe. And I realized at that time that they were not using the same techniques. They were not informed about using 3D nipple tattooing and how this would help people reclaiming their bodies back. So during this 1 year, I prepared myself, because as a scientist, I was reading everything about science and cancer, science and tattoos, how tattoos would impact health, were their relationships with tattoos and cancer and everything. So I did a very thorough bibliographic review. And I asked those surgeons, would you be ready to teach me? How do you rebuild woman bodies? And would you take me as an apprentice if I would jump into that adventurous way of rethinking my life? And they said yes. So I went to a tattoo artist, and I was living close to my place. And I asked him, "Would you teach me? Would you teach me from scratch how to tattoo people? Because I don't want to be a tattoo artist. I want to be a nipple tattoo artist." And so he laughed at me, and he said, "You are crazy. I've never been hearing about that, but okay, I like your project. So come back to me with a lot of drawing, and I want to see if you're capable of doing formal apprenticeship, because it takes time and it takes money for them. It takes very personal involvement." And we've started this together. So I stopped working. I quit my job at that time. That was a crazy thing to do, but it was the only thing to do, because I had to invest me and my time 100%. So it was not something I could do in a part-time way. So it started in 2015, and I spent like almost 2 years learning the technical part of it, but also the surgical part of it with the surgeons. And at the end of my training, I felt it was missing something for me. So I contacted this girl in Texas. No, she was in Canada. This tattoo artist that was teaching 3D nipple tattooing, because Vinnie Myers himself couldn't teach his art, let's say in a very short period of time, and I was not able to fly to the US for like 6 7 months or 12 months. So I entered in contact with this lady, and I booked my plane tickets, my hotel tickets overnight, and I decided that I had to finish my training there in the US. So I flew to Texas in January 2017, and I got my training done there. So I was the very first European female tattoo artist to be trained to this technique there in the United States. And when I came back to France, I was like, okay, what do you do now? And so I was in the hands of a kind of nursery for companies, for like startups, and they told me you should do some crowdfunding to open your own tattoo shop. So this is what I did, and I gained like 33,000 euros in May 2017, and I was able to open the Téton Tattoo Shop in September of 2017, and I was like living my dream, because it was a crazy dream at the beginning, and then it became a reality. And since then, I've tattooed like 800 women and men, and recreated this very high number of nipples back to life. So I'm very glad this dream came true.
If you're enjoying this episode of Paris Undressed, you may also be interested in Navigating the French, hosted by Emily Monaco, who engages in a lively conversation with an expert about a French word and its cultural and linguistic meaning to provide keen insights into understanding the French. Tune into this exciting podcast that goes beyond language. Paris Undressed will be right back after a word from our sponsors. What a parcours. You know, that is, I hear all those beginning words, tunnel vision, bravery, single-mindedness, and courage. So you've talked to the surgeons, you know how to tattoo, but this 3D nipple and areola tattooing, this illusion of dimension and projection without nipple reconstruction, just talk us through the process. I mean, how do you do that with color and the different skin thicknesses, and does scar tissue come into play, or even where does your conversation start first with the woman? What happens first in the process?
So what happened first in the process is to be very humble towards your own capability to draw, because if you want to tattoo, you have to be a drawer. So you have to practice a lot, and it's the only alternance of shades and lights that will create the illusion of the protrusion. So if you can't draw it, you shouldn't tattoo it. You shouldn't try to tattoo it. So first you have to be very humble, because not everyone is a drawer, but not everyone is a tattoo artist that can respect the fragility of a skin that has gone through surgery. It's very thin, it's damaged. The scar tissues are very, even they can be strong and very tough, but they can also shred and be shred and very, very fragile. So you have to look at them, love the skin, and this is your medium. You have to love it, you have to understand it first, and you have to respect it. And behind this skin there is someone that has been through very hard things, from the diagnosis of breast cancer to the loss of their nipple, to the loss of the breast, to the fact that they experienced the chemo, they lost their husband, they lost their work, they lost their friends. And it's a matter of being able to be humble in front of these amount of losses that they've been through. You have to be there like a technician, to be very let's say honest. You can't produce the perfect nipple. You can rebuild it from scratch. You will never give it back to life. You cannot reproduce it the same. So you have to make them understand that you will guide them through this process. It takes time, it takes a lot of intimacy together, but you will take them by the hand and say, okay, I will guide you to a new image of yourself, and I will guide you to this mirror, and you will love what you see. You have to love what you see, because you will see it till the end of your life. So if you don't love it at the instant I put yourself in front of the mirror, we will have missed something. And so this is a kind of contract that you have with yourself, but also with your client. And you will have a bond that only a mother could have with a child. I'm not recreating their bodies like their father and mother have done, but in a sense, I'm here to, like a petite main in the fashion industry. You are using everything you have, the science, the artistry, the love for the person you have. You don't know them, but you have to love them to build this intimacy together. So it's a long way of learning, and I think you can never stop from learning from this technique, because it's different from one person to another, and you have to be very adaptive. And the only thing I know is that I don't know everything, and I still have to learn a lot. So I flew back again to the United States to complete my training in another technique, this time with a guy, a tattoo artist, that was dedicating his time to decorate the scars, not hiding them, but integrating them into the patient's story, into their willingness to love the body that they have. Is someone who has guided me. His name is David Allen, and is a Chicago tattoo artist, and is a wonderful human being. And the fact that he's a man, and that is everything he's doing is sublime. Everything is touching, is putting magic. With the art of tattooing, you can create something beautiful from something most of the people consider awful and traumatic. So this is a very nice way to link heart and love. And this is something I would like people to understand. This is not a kind of job that you do for a living. You have to be very humble, and to imagine the impact that something you would have done not in the purest way would have negative impacts on people. And this is my fight today. I'm not sure I'm expressing myself correctly, but I'm struggling a lot to have this form of art recognized and protected from a mercantile aspect of it. It's been a lot of publications, of TV shows, interviews on what I was doing, and it was good because patient had access to this new way of reconstructing their self-esteem. But at the same time, I was not able, as a scientist, to build up clinical studies, to build up medical and scientific evidence around this kind of technique that would have made it protected with recommendation and good practices and everything that would have avoided this to be done by anybody. And now every tattoo artist on the corner of the street can do that. Beauticians can do that, and they tell people they are doing nipple tattoos, but in a sense, it's not only coloring circles in pink, brown, or beige. It's many, many, many more things.
It's much more complex and nuanced. I'm wondering about two aspects: that your work is supported by the medical environment. Is that problematic? If I'm a woman, and I am a woman, and I've had breast cancer, and my breasts have been, well, removed and reconstructed, or just part of the breasts, am I told that a nipple tattooing exists, or do I find out about that on my own?
Well, it depends on the level of consciousness of the surgeon. You have two different types of nipple tattooing. You have the one that is being done by the surgeon in the hospital or by a nurse in the hospital, which is using semi-permanent pigments, like permanent makeup. They use pigments. When you are doing a traditional tattoo, you are using ink, which is a permanent pigment. So you have different techniques done by different people with a different type of training, with a different intent, and with a different result. So if you are operated in a hospital, you may have a nipple tattoo done by your surgeon or by a nurse, which is basically like a circle, which is colored and will not last more than 1 or 2 years of your time.
So I have to keep coming back.
You have to keep coming back, and each time you get tattooed, your skin will suffer and the results will be poorer and poorer. The color will fade over time.
And I have to go back to the operating room.
Yes, and after
Yeah.
3 attempts, most of the women, they say, okay, it's not working on me.
Forget, yeah.
It's my fault. My skin is not good enough. And they have a shame of showing back their bodies. And that's why this kind of technique, more artistic, was created. So if you have a surgeon which is open-minded, who has regular contacts with his peers and sees with no issues the fact that he's not doing the best for his patient, and he says, okay, I can guide you to another person who is doing this better than I do, because it's her daily job. And that was, at the beginning, that was how they reacted. But the fact that I was doing it on my own and I was alone created some demand, and a lot of people, they understood that there was a market to conquer. And so a lot of people opened their own nipple tattoo parlors and everything, but they didn't go through the whole process in terms of training, because not everyone is able to fly to the US to get a proper training. And I must say that even the training I got there in the US was not sufficient. I had to teach myself for 1.5 years in knowing how the color reacts into the skin, depending on if you have had radiotherapy, if you have a lot of melanin in your skin, if you have been through a lot of scarring. So this takes time, and it's still not taught the right way. So these people can attend like 2 days or 3 days training, and they have a certificate stating that they are enabled to do nipple tattoos, but in the fact, there is no verification of their level of achievement in that term and the results. And they are most of the time taught with semi-permanent pigments, which is not the same in terms of result and durability of the aspect. So the struggle is real. The doctors, they found something. They have now a lot of people doing this around them, and they have renounced having a high quality result. At the end, they can send you to the tattoo shop at the corner of the street. They don't take care about what you put into that process and how you can be supportive of the patients. They see this as a procedure and not as a real journey for the patients.
Okay, sorry, I didn't understand who sends you to the corner? Is that the surgeon or is that
Yeah, the surgeon or your oncologist or your physiotherapist or anyone who's involved in a breast cancer environment can send you to any specialist. But the problem is that there is no recognition of this particular technique, and there is no,
I see what you're saying.
yeah, there's no barrier in doing it. So at the end of the day, when the COVID situation arrived, I had to close the Téton tattoo shop for a while, 2 times, 3 times, and that was my 100% activity. So I had to find a solution to go through this. So I started back working in a full-time job, and I held down the Téton tattoo for a while. And now it's not yet open, but I'm very confident that next year will be the revival of the Phoenix. But I would love to step back into having doctors and scientists sitting together around a table and listening to the patients and listening to those who have been through bad nipple tattoos, and how this has impacted as very negatively their self-esteem. Because if you have it done the wrong way, it's the final step of your reconstruction. So you can have the perfect breast shape, the perfect symmetry between two of your breasts when they are reconstructed, but if nipple is not placed the right way, if it has not the realistic aspect that makes it disappear, you shouldn't do the difference between the two of them. One is flat, the other one is as volume. But when you look at them in front of the mirror, if it's done the right way, you cannot see the difference.
Right, you have that aesthetic beauty again. You have that aesthetic, visual to look at in
Yes,
yourself.
and when you see that nipple that looks the most you can to the other, you have to forget the scars that can remain around it. And I'm not pushing my clients to disguise those scars or to hide them. I just teach them to love them. And when you look at the whole reconstruction at the end of the road, if they see convincing nipple, they will forget about the scars that are there, and they will look at it like, okay, that's my new body. I have to learn how to love it and to live with it. And the most emotional period of time for me is when I push them through the mirror. At the end of the 45 minutes we have spent together, the tattooing itself takes 30 to 45 minutes within the 3-hour session we have together. The whole time is like building the confidence, building the trust, building the right mood together to trust each other.
Right.
And they give me this responsibility, and at the end of the session, I'm quiet, I'm silent, I'm putting them in front of the mirror, and they are like living it fully. Some of them will cry, some of them will laugh, some of them will remain silent, and that's somehow scary for me. But they have to take this picture of themselves in very moment in the mirror, and things are over. The journey ends right here. And then they have to walk through it again and start loving this body, taking care of that little part of themselves. They will have to pamper it, to put cream on it for a few days. And some of them are rebuilding a relationship, very, very intimate relationship with this part of them. And they buy bras, and they buy like these transparent bras they wouldn't have bought previously. And when they come back for, some of them, they come back for a touch up, I can see this beautiful lingerie, and they cut their hair. They start using makeup again. They've lost some weight. They've gone back to sports, and they took care of everything around it, and they forgot about this very simple detail that was like they were ruining their life. So
Mm-hmm.
it's such a big mission that we have, that I would like to have people understand that it's not simply drawing circles and coloring them.
If you're enjoying this episode of Paris Undressed, you may also be interested in romancing in Paris with host Lily Heisey as she reveals the most captivating romantic places in Paris. Tune into this dreamy and sometimes steamy podcast. Paris Undressed will be right back after a word from our sponsors. For our listeners, so if the reconstruction part doesn't happen right away most often, so women have time to consider this. You from the diagnosis through the treatment, you have time to adjust, absorb, heal. And this is something that happens. There isn't a time limit on it. This is something that can take some thought and some consideration. So for somebody listening who might be interested in pursuing a nipple tattoo, can you maybe give us 3 things that she should be asking anybody before she starts? What would be 3 things to just make note of, to know that she's headed in the right direction, either herself, mentally and physically, and vis-a-vis the other person in front of her?
Well, the first thing she has to do is to ask her doctor if she has the appropriate health stages to go through a tattoo. On my website, I have a list of contraindications that are related to health. For instance, if you have a autoimmune disease, getting a tattoo might not be a good idea if you have had cancer, because we know that immunity and cancer are really good friends. And if you're hitting immunity, you may hit cancer back. So, as a biologist, I was very keen on working on those aspects. So, I'm conscious that I'm just an artist. I'm not a doctor, so I don't know everything.
Mm-hmm.
So, first, women should check with their doctors whether they can be tattooed in a safe way, because if they have contraindication, they may consider another option. Second question they should ask themselves is, how important is that process to myself? Do I consider it like a process on itself, or is it something I just want to check on my bucket list? If something is not important, and if they prefer to be in the, let's say, curative part of the treatment, they can consider having this nipple tattoo done by the doctor if they don't give it an aesthetic sense in their projections. If they see that this is something that they will have as a very important need in terms of rebuilding their self-esteem, they should be considering the level of skills of the tattoo artist they will go through. You can ask the best tattoo artists if they can do realistic tattoos, and they will portray your grandmother, your dog, and or everyone in a very good way, and they can be very good on that. But most of them, they are not very comfortable in doing nipple tattoos, because this is something so intimate. You have so much intimacy. You have so much history, so much pain, so much things into that they cannot be very comfortable in working with damaged skin, scar tissues, radiated skin. This skin is no longer skin. So if you have no experience at all in tattooing this kind of skins, don't do that. Don't try it. It's not something you can improve. You can improve in doing it. You have to be taught, and then you have to be very, very, very careful. So you can ask the best tattoo artist.
So talk to your doctor. So number one, talk to your doctor about your health issues and if tattooing is a possibility. Two, back to the question at the beginning, what is a nipple to me? Is this even something that's important? If it's not important, maybe I don't even need to reconstruct any of it. And if it's sort of not a big deal, yes, any kind of color might work. Or you know what, this is more important than I thought. I need to look into this further. And if I'm pursuing a tattoo nipple artist, I guess then it would be important to see examples of the work he or she has done.
Of course, of course, and I would say further, long time healed results. You can have very, very realistic tattoos done in an immediate way, very realistic, very full of details, and it's always the case. But when you look at them 3 months, 1 year, 10 years after, it's pretty sure that they will lose lots of details, lose the volume effect. And this is prone to this is also related to the competency and the humility of the artist, because these kind of tattoos, they will evolve over time because skin has been damaged forever, and there is no way this skin can react the same way that the skin that is around will react. And this is something that the tattoo artists have to have in mind. The colors you are putting into the skin at that time, it will not be the same if you're tattooing a shoulder or a knee or a thigh than tattooing a radiated part of skin, which someone can have been, the breast can have been rebuilt from your muscles and your grease and your own skin from another part of the body. And you have to know where the skin comes from to tattoo it the right way. So first, ask your doctor. Second, ask your tattoo artist, and maybe also ask your relatives, ask your husband, ask your partner, ask your sister, mother, and everything, and ask them if maybe this process, you have to be, you cannot go through this alone. So you have to have people around you, pampering you, guiding you, and helping you to have it done the right way. So sometimes the nipple itself may not be a full need, and sometimes we can go to the decorative tattoo of the scar. And sometimes it's not only the nipple, but also the poetry around the breast that we can rebuild. Or if the person chooses not to reconstruct the breast, but because they can choose this option too. And let's say 7 women out of 10 will not reconstruct their breasts and they will choose to stay flat. So these women should not be excluded from our discussion today. Sometimes you can discuss with your artist and find a symbolic way of rebuilding femininity and rebuilding beauty through an art form. And I'm always using floral designs, because I think flowers can always bring something good, and they can be very symbolic, but they can also be just beautiful. So you don't have to find a sense in what you are doing. If you just think this is pretty on you, go through it.
Alexia, what you're saying is just so important at every level, in that the conversation itself, in figuring out what's important to you, and if just back to the breast in general, if you don't, and women probably don't know this, that most women don't actually do the reconstruction. It's a whole different subject, but this idea of who said breasts were part of your femininity? Maybe in the end they aren't, and to bring this conversation out loud with the women and the people and men, included, just what is a nipple, what is a breast, and what does it mean to me? And then from there, these choices either unfold or not, but it's your choice, so that you're not also then building something for somebody else, But if it's not a conversation that can happen, then it's not something that's going to feel resolved in any way, and then you can't heal, move forward anyway. So it's just important to just ask yourself some very simple questions and give yourself some honest answers, and maybe it needs time for those answers to come and more conversations. So to let that nourishing, there's so much nourishing in your voice and in the art that you do and in the time that you're giving women. And I think you said earlier, you talked about the poetry of the breast. I just thought that was absolutely beautiful. It's not necessarily, again, maybe it absolutely has nothing to do with the nipple. Maybe it's just going to be at the scar and the massaging or just leaving it as it is. But this time and space for femininity and sensuality
Bloom back.
Yes. And that I wanted to know, how has helping women feel more beautiful influenced your own perception of beauty?
Well, I think being a teenager who has struggled a lot with femininity and the way I was perceiving myself as a woman, being a mother, being a science woman, being an entrepreneur, it's a whole thing. And these women have helped me understanding. It's like a diamond when it's raw. You have to work to give it a right shape, but you have many faces to look at it, and those different ways of looking at yourself can be either positive or negative. It depends on the mood you are in, but it's the whole thing that makes you beautiful. If you consider that you have times where you're not considered beautiful or you're not being in a positive way, and at the end of the day, if you love yourself, you can expose all those different aspects and faces to the whole world, and you are living at the very center of it. So learning how to love yourself, and this is why I try to teach them, um, when you are in front of the mirror, these women, when they go through the surgery, through the chemo, they lose their hair, they the most difficult part of it is when they're facing the mirror, because they are facing their own image, and they're also facing the image that the society is bringing to them. And we judge this image at all times because we have social media showing perfect bodies with filters and everything, and you have to open your eyes to the crudeness, to the wholeness of the beauty, and rethink it. A body that has been gone through cancer and with scars, with different shades and holes and everything, can be beautiful.
Mm-hmm.
But if you don't see them on social medias, on web, on your friends, you will be blind to this beauty. And this is the major thing I've learned during these years. I'm responsible for showing these bodies to the rest of the world, so that people looking at the mirror, they can say, "Oh, I've seen bodies that were looking as bad as mine, or as good as mine, or I don't have to put myself into a cursor. This is how I am. All bodies are different, and all bodies should be loved, and all bodies can be loved, and all bodies should be loved. So we have to see them, to integrate them. And being the mother of a child with disability, I'm teaching, and I'm struggling, and I'm advocating for the beauty of difference, and the fact that we are all different, and this is good for the world. So these damaged bodies, these damaged souls, they have to find in this very intimate process of tattooing just the first step on loving themselves. It's the ignition. It's like a match that you ignite, and you let them take the responsibility of what is happening after.
Well, there's an expression in French, bien dans sa peau, to feel good in one's skin or to feel good about oneself. And your work and your advocacy literally nourishes and heals, and you transmit this to the women around you to feel better in our own skin. And thank you. It's been an honor and a privilege to speak with you today. Thank you for joining us.
Thank you so much, Kate. Thank you for opening your mic to this very particular story, and I'm glad people can hear about it. Thank you.
We will have Alexia's contact information in the show notes and your website, but perhaps you can tell our listeners where to find you.
I'm on Instagram. You can type Alexia Cassar and you will find my profile. It's not very easy because I'm shadow banned by the social media, so you have to be very insistent, but you will find me.
Okay. We'll be insistent.
Yes.
Thank you. Okay.
Thank you
very
so
much. To learn more about Alexia and her work, visit her website, thetetonstattoosshop.com. That's TheTetonsTattoosshop.com. Or follow her on Instagram at _ALX_C_. You can also find the links on our episode page. And thank you. Merci for listening to Paris Undressed. If you enjoy this podcast, please share and subscribe so we can continue to connect our stories one bra at a time. And you can find me, your host, Kate Kemp Griffin, on all socials at Paris Undressed and at Catherine Kemp Griffin. Paris Undressed is produced by Paris Underground Radio. For more on this show and shows like it, please go to parisundergroundradio.com. Merci et à la prochaine.
This episode of Paris Undressed was produced by Jennifer Garrity for Paris Underground Radio. For more on this show and shows like it, please visit parisundergroundradio.com.